Welcome to the first installment of Coffee with Jenn and Jason. I'm Colonel Jen Walkawicz, the commander of the 733rd Mission Support Group.
And I'm Lieutenant Colonel Jason Faulkenberry, the commander of the McDonald Army Health Center.
What we are here today to do is really bring you back up to speed on where we've been with the installation's preparedness for the coronavirus efforts. We really appreciate all of you who were able to attend our town hall last Thursday, but a lot of things have happened since then, and we realized that maybe we haven't been communicating as often and as frequently as we should be with each of you. So today's session is all about letting you know what has happened since Thursday, providing you an overview of installation response, and also the medical situation. And I know that's probably what most of you are really looking forward to and want to hear about. So not only is Jason Faulkenberry the commander of our health clinic, he's also a public health officer with over 22 years of experience. So Jason, can you kind of walk us through what is the situation now on Eustis, across JBLE, and even in the region and the state?
Yes, ma'am, absolutely. So, of course, our patient safety and our beneficiary safety is a priority. So we've taken initial steps. As early as January 27, we started screening all our patients that were coming in, asking those questions. Now, of course, with the elevation of the HPCONs, or the health protection conditions, we've now elevated it where we've pushed out those capabilities. So we're screening people in a series of kind of checks and balances. The first initial screening is happening before anyone even comes to the MTF. Ideally, we would like to capture those individuals. So we have a 24-hour number where all the units and all the installation commanders or anyone that's concerned can call and get some further guidance. So that's our first line of defense. Our second line of defense is anyone that's coming now into the MTFs or any one of our clinics, because we have a lot of clinics that are outlined as well. So what we've done is we've limited the access and entry points to just 1 or 2 locations, and we have screeners there. And they'll ask you a routine line of questions that we have codified. And of course, these questions, we're working with the CDC and our state partners. We're not doing this in the vacuum. And depending on the criteria, then we'll send you to a secondary point to get additional screening, medical history, and if needed, we can also sample or pull a test, basically, pull a sample test.
And I know that's a question I'm getting a lot when I'm out talking to our workforce and our family members is, do you have the ability to test? So you can walk through how that goes on the installation for us?
Yes, ma'am, absolutely. So whoever meets the criteria to go to that secondary test, then we immediately call our public health officer, a physician, and again, he kind of goes a little bit more into detail to figure out, does this person really meet any of the criteria, the CDC criteria for testing. So we do have the capability to basically sample. We would pull the test, or what it is a swab, and then we will send it off to an outside lab. And this is comparable to what we do with a lot of the labs that we do here. We don't run a lot of those tasks within our actual laboratory. We send them off. So what we would do is we would pull the sample and we send it off to a series of labs. Right now we're working with a civilian contractor, but we also have state labs and we also have additional military labs.
No, I really appreciate that. And the other question I get from a lot of people is, have we had any person test positive for coronavirus on the installation? And right now the answer is no. So please rest assured that if that occurs, we will provide that information as it becomes available. You've actually had to test no one, is that correct?
Yes, ma'am.
So across JBLE, there have been 0 positive coronavirus tests. And now that doesn't mean we don't have people that we've asked to restrict their movement. DOD, along with both Headquarters Army and Headquarters Air Force, has asked us to restrict movement of anyone really returning from overseas right now, a CDC level 2 or 3 country. And right now that's worldwide. So for soldiers, for our DOD civilians that are returning from an overseas assignment, whether it's PCSing or it's a TDY, they've been asked to go into 14 days of restriction of movement. So where that becomes confusing is a lot of people hear that we have soldiers quarantined here on Eustis, and they don't know what that means. That causes a little bit of fear and trepidation that means we now have coronavirus on the installation. No, those are all precautionary steps that we're taking, because remember, your safety and the safety of your families is our first concern. And now across the installation, a lot of things have happened too over the weekend. So we're working through the stop move policy that DOD issued. And that does impact some of you, I know. Anyone scheduled to PCS between now and May 11th has been told to stay in place. And our command teams are working to identify those soldiers who may have been in the process of PCSing that have been caught up in this. And we're doing everything we can to take care of those service members and their families. Additionally, because of the regional increase in the number of positive cases that we've seen throughout the peninsula, we have elevated the health protection condition to HPCON Bravo effective this morning. What does that mean for you? Well, that means you're going to start to see a little bit of a disruption in normal services that we provide. We made the hard decision to help stop the spread of this virus, that we have closed all of our non-essential recreational facilities. That means the bowling alley is closed, ITT is closed. What we do have, however, is that we have left the fitness centers and the pools open for the time being. We are assessing those on a daily basis, and when conditions warrant, and based on the medical advice that Jason and his team will provide, we will start to close those facilities. Keep in mind, though, that we still have a mission to do here on the installation. And we still have medical professionals that are coming to work every day. We still have military members and DoD civilians whose work is so critical to our national defense that we have to keep the mission going. So we will provide services as necessary, such as keeping our CDCs open as long as possible, our child development centers, not to be confused with the Center for Disease Control, because there's two CDCs in this conversation. But we're going to keep those open as long as possible and as long as it's safe. We are setting up, with the help of Jason and his team, additional screening notes throughout the installation to make sure that those coming onto the installation are not feeling ill. But that's where I need your help. It's a personal responsibility that if you are not feeling well, if you believe you have come into contact with someone who has been exposed to coronavirus, that you do not come to work. Call your supervisor, call your primary care manager, and ask them for further directions. Right now, individuals are getting concerned. They're wondering if they should go ahead and quarantine themselves. We need you to have a medical assessment. We need to identify if you have additional risk factors that should potentially be tested, as opposed to just going into a quarantine or a restricted movement status. So please, if you feel sick, if you feel ill, call your medical provider and take guidance from them, and then let your chain of command know what's going on. There are a lot of questions out there about how this week is going to unfold. We don't have all the answers. But what we know is that if we are united in our effort and we work together and we all are as patient as possible, that we'll get through this together. This is going to be our new norm. I don't anticipate that next week we'll be back to business as usual. This could be the next 4, 6, 8 weeks. And we will do our best to keep you informed with all of the actions that were taken from an installation and a military treatment facility posture. Because remember, we are preparing, we're ready to respond, and we're ensuring that you and your family members are protected. Jason, can you think of anything that we should have talked to our audience about today that I haven't covered?
I think, Ma'am, you said it perfectly, is that personal responsibility. History has taught us that the one thing that works better than everything is personal hygiene, washing your hands, and then that isolation, quarantine, and restriction of movement. I know everybody's looking for a vaccine or a miracle cure, and I know there's about 20 of them that are in development, but at the end of the day, the one thing that works is exactly what you said, is that isolating, removing restriction of movement, stop going out, stop going to unnecessary functions, and good old personal hygiene.
Yeah, I appreciate that. And if you have questions, for the service members out there, talk to your chain of command. Each organization on the installation right now is working through what does social distancing mean in terms of the workforce. How many individuals can telecommute? Do we do alternate work schedules? Those are the hard decisions that every organization is trying to make today and tomorrow, and we will put that information out as soon as it becomes available. I appreciate all you do for the installation. Stay safe, and we'll see you on Wednesday with our next Coffee with Jenn and Jason.